Do you think that this 24-hour truce might be the first step for a ceasefire in the conflict? And how could the 24-hour ceasefire help organizations like MSF?
Of course, we always hope for the best. We really hope that this 24-hour ceasefire is a step in the right direction. We can only hope for that. For sure, any let-up in the violence is not only helpful for the civilians, but then also for the health workers to be able to go to access the patients who are affected by this conflict and provide the necessary care. So any let-up in the violence is actually welcome. But for sure, 24 hours alone is not enough because most of the population has not had access to healthcare for now over the last 96 hours. Yes, any let-up in the violence is actually welcome to us because it provides at least space and access to healthcare for those who are really affected. But what is disheartening is that even these 24 hours hasn't really held up in most of the areas, has already been broken. So what we again really implore to all those involved is to actually have a proper ceasefire that to end this violence and people come down to talk.
Although you already have a small team doing surgeries in El Fasher, how long can this precarious situation last? What are the supplies you are most lacking that could cause you to leave patients untreated?
I'll give an example that within 72 hours we had over 180 patients coming in with various forms of injuries, all requiring urgent medical care. And with this, you need the dressings, you need the antibiotics, you need things for pain, you need to replace all the blood that they've lost with the fluid. So all these supplies we're actually running out. And these are very important in stabilizing of patients who are affected by who. Yes, also in addition, in regards to the care we're providing in our Fasher hospital and where our supply levels stand, right now with the fighting still ongoing and also based on the number of patients that we're seeing, there is urgent need to get more supplies in the country, and also not only the supply but also the human resource, because the team that we have on the ground has been bankrupt for the last 96 hours. They're really exhausted, and so we need more human resources to come in. So that means we need access, and then also access for the supplies I mentioned earlier to really come in to deal with the victims of trauma.